We're going to get started shortly. I'm just going to give people another minute or so to join and just make sure that their audio is sorted out. Can everybody hear me okay? Yeah, cool. Okay, I am going to get started, and we will just let people in as they join. But thank you very much, everybody, for being here. This is the third webinar in our series related to our report, Person First, an investigation and legal analysis of people with intellectual and developmental disabilities in New Jersey nursing homes. So this is the third webinar, but we're going to talk about the second key finding as it relates to the PASSAR process. So just some general housekeeping to start. So the webinar is being recorded and it will be posted along with the other webinars that we have conducted in our final webinar happening next week on our website. There are also closed captions available for the presentation today. I would just ask that everybody please remain muted throughout the webinar and hold any questions until the end. However, please feel free to drop any questions that you might have into the chat feature. We will be monitoring it and answer questions at the end of the presentation. My name is Bren Pramanik. I am the managing attorney of the institutional rights team at DRNJ. And then we also have Gwen Arlowski, our executive director, here as well today. Okay, so again, as I mentioned, this is related to key finding 2 of the report. And really, essentially, the finding that we have in the report is about the New Jersey PASSAR process. And PASSAR stands for Pre-Admission Screening and Resident Review. And really, the biggest finding that we have from our research, from our work related to the PASSAR process is that it is broken in New Jersey. So really it fails to meet basic compliance with federal law. And then it also fails to serve as an essential component of New Jersey's Olmstead compliance strategy. For those that are unaware, and we've mentioned Olmstead several times in our prior presentations, but Olmstead is it's Olmstead versus LC. It is a case that was decided back in 1999 by the U.S. Supreme Court that relates to allowing people with disabilities to live in the least restrictive settings possible. So that's so much of the work that we do at DRNJ is around what's set forth in Olmstead, and PASSAR is supposed to be a tool of Olmstead and really serving as a way to keep people with disabilities, particularly intellectual and developmental disabilities, out of nursing homes. But again, our analysis really determined that component of PASSAR is not being complied with. And so this leads to an over-institutionalization of individuals with intellectual and developmental disabilities in nursing homes. And it leads to the failure to provide specialized services. And I'll get into all about what specialized services are, but it fails to meet that requirement under federal law. So just a little bit about the history of PASSAR. So PASSAR, and again, that stands for Pre-Admission Screening and Resident Review. It was originally part of the Nursing Home Reform Act of 1987. And this applies to all Medicaid certified nursing homes. So if a nursing home is certified by Medicaid, every individual that is trying to go into that nursing home should have a PASSAR completed. And that's regardless of payer source as well. And so the purpose really is, again, to evaluate individuals and try to flag if they have an intellectual or developmental disability. And this also applies for individuals with mental health disabilities. The term that's used in PASSAR is MI, mental illness. We typically tend to try to stay away from using that word just from the stigma attached to it, but it is still mental illness. MI is still the term that's used in the PASSAR. So we do have to refer to that sometimes just to make sure we're all talking about the same thing. And again, the purpose is to evaluate applicants for IDD and mental health disabilities, to offer the most appropriate setting to people with an emphasis on the least restrictive setting, as is required under Olmstead. And then it also is to provide all services, including specialized services in nursing homes. So again, we're going to get into a little bit about specialized services, what the rules are in New Jersey, how New Jersey is getting it wrong, that kind of thing. But those are really the preliminary purpose of PASSAR. And again, New Jersey fails to meet many of those purposes. And again, we'll get a bit into that. So I just wanted to start off by talking about the process for how the PASSAR process really works, because it is pretty confusing. But there is basically a level 1 evaluation. And again, that is something that is conducted for all individuals that are going to go into Medicaid certified nursing homes, regardless of their payer source. So again, that's kind of everybody is supposed to get a level 1 evaluation. And, it's again, really, it's not based off whether you have a disability or don't have a disability, payer source, anything like that. Everybody is supposed to get that level 1 evaluation. After that, though, is when it starts to get a little confusing, hard to keep track of. There is a level 2 evaluation that occurs, but there are also a few different things that can happen that might either prevent a level 2 from being completed. And it's also possible that you won't get a full level 2 evaluation. So again, we'll get a bit into that. And then also talk a bit about the resident review of PASSAR. So again, it's pre-admission screening and resident review. And the laws have changed a bit as it relates to the resident review aspect of it, but there is also that aspect of the PASSAR process. So the level 1, again, like I said, it's supposed to be completed prior to nursing home admission. And it is something that all individuals that are trying to reside into a nursing home, that has to be completed for them. So again, that's kind of really the easiest, most simple. Everyone really is supposed to get a level 1 evaluation. And again, it is supposed to evaluate for suspected intellectual and developmental disabilities or a mental health disability. Now, in the initial PASSAR process, it's typically referred to as a negative assessment. So in that level 1, if you're evaluating somebody for intellectual and developmental disabilities or a mental health disability, and you determine that they do not have either of those, then their level 1 is determined to be negative, and that means that they can be admitted to a nursing facility. But again, that needs to be completed. There needs to be that determination that there is a negative evaluation, and then they can be admitted to a nursing home. When there is a positive screen, so there is a positive screen for intellectual and developmental disabilities or a mental health disability, then what is supposed to happen is a level 2 is supposed to occur prior to nursing home entry. But again, like I said, there's a lot of different things that kind of happen in this process that might prevent a full level 2 evaluation from being done. But that's kind of just the basic gist for how the level 1 evaluation goes. So if somebody does have a positive level 1 evaluation, there are what are called determination requests that can occur. And there is a 30-day hospital exemption, there are categorical determinations, and then there is a primary dementia exclusion as well. Again, these can get really confusing, and I think, there's a lot of misunderstanding about these things, but those are kind of the determination requests that might prevent a full level 2 from happening or a level 2 from happening at all. Okay, so in terms of the determination requests, so the first one that is possible is called a 30-day hospital exemption. And so this is when a physician certifies that an individual needs 30 days or less of like rehabilitative services in a nursing facility. So they need a nursing facility level of care. However, it's supposed to be only on that short-term basis for about 30 days. So on the level 1 form, if somebody is positive and they have a diagnosis of IDD or mental health disability, the physician can also certify this 30-day hospital exemption, saying that this individual will need less than 30 days of nursing facility level of care, and that they can, at that point, the level 1 evaluation is sent to the appropriate level 2 agency. So that would either be DDD for individuals that have a suspected intellectual or developmental disability, or the Division of Mental Health and Addiction Services if somebody has a identified mental health disability, or both if they do have a co-occurring. And there is also, that is also forwarded to OCO, the Office of Community Choice Options. So again, if somebody has a positive level 1 screen and a physician certifies that they need less than 30 days of a nursing facility level of care, that level 1 and that request for that 30-day exemption is forwarded to the appropriate agency. It's forwarded to OCO as well. And an individual can be admitted into a nursing facility without a level 2 evaluation being completed. But there is a big caveat to that, and that is that if it is determined that the individual is going to need more than those 30 days of a nursing facility level of care, the nursing facility is responsible for, in writing, notifying the agency that they're going to need, that individual will need more than 30 days of a nursing facility level of care, and give an explanation as to why. And then a full level 2 evaluation is supposed to be completed prior to day 40 for that individual being in a nursing facility. And this was an area in which we had a lot of concerns, and a lot of those I'll get into a little bit later. But again, the onus really is on that nursing facility to identify when somebody is really approaching that 30-day mark, that they're going to need continued care, let the appropriate agency know, and then that full level 2 evaluation is supposed to be completed prior to day 40. So that is the 30-day hospital exemption. Again, you're not going to have a full level 2 when there's a request for a hospital exemption, but that is one of the first of the determination requests that somebody can make related to a level 2 evaluation. Then there are also categorical determinations. And so in New Jersey, there are 4 categorical determinations: adult protective services, respite care, and then there is a request for terminal illness and severe physical illness. So adult protective services are supposed to occur, they're supposed to not exceed 7 days that an individual will be in a nursing facility. In terms of respite, it is supposed to not occur for longer than 30 days that an individual is going to be in a nursing facility, and that really is to help give the caretaker some respite. So those are very time limited. APS and respite have very distinct timelines that are available, and that would be, again, an exception to a full level 2 being evaluated. So if you were to request a categorical determination, the level 1 evaluation would be completed. Somebody would be identified as positive for suspected IDD or a mental health disability. That would be forwarded to the appropriate agency. And there, at that point in the level 2, there would be this request for either any of these categorical determinations. So adult protective services, respite, terminal illness, or severe physical illness. And this is really, again, something that is supposed to be time limited, and is really, just supposed to make it so that that maybe a full level 2 isn't done at this point, but there is room for a full level 2 evaluation to be completed in the future if necessary. And then for a terminal illness, that is supposed to be somebody that has a prognosis of 6 months or less. And then a severe physical illness is a mental condition that prohibits or doesn't allow somebody to take advantage of the benefit of specialized services. And then there is also the dementia exclusion for individuals with mental health disabilities. And that is when an individual has a co-occurring mental health disability along with a diagnosis of dementia. And dementia at that point is supposed to be the primary diagnosis. And that if there is a request for this dementia exclusion to a full level 2 evaluation, that is sent to the Division for Mental Health and Addiction Services in order to request that full level 2 evaluation is not completed. Okay, so again, what are specialized services? So specialized services are what they are supposed to be is they're supposed to be provided to nursing home residents and primarily in a nursing home. So this is really where New Jersey gets the federal law incorrect, because under New Jersey law, an individual cannot receive specialized services in a nursing facility. But specialized services are supposed to be provided to nursing home residents, primarily in a nursing home setting, but it is not exclusive to individuals that are in a nursing home. And specialized services are not provided in an inpatient setting like a state psychiatric hospital, and they're also not provided in a setting like a developmental center, which is also referred to as an intermediate care facility. And specialized services are above the typical services that are provided in a nursing home, and set forth in the comprehensive care plan for an individual. So again, the specialized services really go beyond what is typically provided in a nursing home level of care. And there can be waiver-like specialized services that exist. Again, I'll get into that a little bit later, what that means. But there is a possibility for these waiver-like specialized services. And that really kind of comes into play where an individual is not necessarily receiving specialized services in a nursing home. And again, that is meant to foster continuity of care for an individual. So again, what are specialized services? So they are whatever disability-specific services a given PASSAR individual uniquely needs. So this is above, again, what a nursing home provides under the standard reimbursement rate. So specialized services are supposed to be very bespoke to the individual. You're supposed to take into account person-centered planning, and they go, again, above what a nursing home typically provides under that standard reimbursement rate. So some examples of specialized services are a continuation or development of an individualized plan for rehabilitation, skill development, behavior management, a continuation or development of a day or vocational program. Again, so it is important to note that a specialized service is not just a specialized service can be something where you're kind of helping somebody to gain a particular skill. It's not just necessarily kind of maintaining that skill, but it can also be a development of a particular skill. Development and implementation of positive behavior supports plans, emergency safety interventions, support and consultation to reduce negative behaviors. And additional one-on-one time with a qualified IED professional to maintain independence with choice, activities of daily living, and other functional skills, as well as provide advocacy, mode of communication, and communication with family. So again, specialized services are really supposed to be very bespoke to the individual, and it's not just one thing. It can be different things depending on the needs of that particular individual. So just to kind of touch on what is supposed to occur during a full level 2 evaluation. So again, There is a level 1 evaluation that is completed for all individuals trying to enter into a nursing facility. There is that 30-day hospital exemption that can keep an individual from receiving a level 2 evaluation while they're supposed to be receiving that rehabilitative care. But a level 2 evaluation is supposed to take place at day 40. There are the categorical determinations that I had mentioned as well, which if you are requesting a categorical determination that is completed on that level 1 evaluation, it's sent to the appropriate facility or the appropriate agency. And in that level 2 evaluation, you explain, the need for that categorical determination, but a full level 2 isn't completed. And then there is also the dementia exclusion. But in terms of when a full level 2 evaluation is completed, this would occur. It should occur after, if somebody has that 30-day exemption, by day 40 it should occur. Again, those categorical determinations are supposed to be time limited. So it should occur potentially even if somebody does have a categorical determination, or if somebody has a positive level 1 screen, but there is not a request for any of those determinations. So there isn't a request for the 30-day hospital exemption, for the categorical determinations, or for a dementia exclusion. So that would then mean that somebody receives that full level 2. And the key components of this evaluation is really, it's supposed to be a summary of an individual's medical and social history. There are recommendations for appropriate treatment for that individual. There are recommended nursing facility level of care, what will meet their needs. If it is determined that specialized services are not needed for an individual, it's recommended that what services of lesser need than specialized services would be appropriate for that person. And if those specialized services are needed, the specialized services like I had spoken about previously, then what are those specific services needed to meet the person's needs? So again, it's supposed to be a process that is very individualized, that is very person-centered, and that full level 2 evaluation really is not supposed to serve as any kind of rubber stamp. It's not supposed to just be a quick review of somebody's medical records where you see, yes, they have, perhaps they do have a diagnosis of IDD. However, they don't need those additional specialized services. So it's really supposed to be a very thorough evaluation. And again, that's very individualized, that's very person-centered, and any recommendations stemming from that level 2 evaluation is supposed to really go to the needs of that person that the evaluation was completed for. And then I do just want to make note too that individuals do have appeal rights when it comes to the level 2 determination. They have a right to a hearing for erroneous determination regarding the PASSAR process. But I do also want to note that in the PASSARs that we reviewed, in the documentation we reviewed, there are very limited appeals that are going through related to this PASSAR process, to this level 2 determination. But it does mean still that individuals do maintain these rights to that appeal. Okay, so like I said at the outset, the biggest finding that we found was really that New Jersey gets this law wrong. And so where that comes in is with there's a few different reasons, but the biggest is that New Jersey defines specialized services as services that cannot be provided in a nursing facility. So if somebody is determined in that level 2 evaluation to need the specialized services, like I had mentioned earlier, they are not allowed to be admitted into a nursing facility. But that is in direct conflict with federal law, which does explain that specialized services can be provided in a nursing facility level of care. So that is really the biggest, one of the most egregious errors in terms of New Jersey's implementation of the PASSAR process, is that that is just simply not true, that specialized services cannot be cannot be provided in a nursing facility. And so when we were looking at the implementation of the PASSAR process to try to maybe understand where some of this confusion came in, part of that is certainly, I think, due to a confusion about the pre-admission screening. So that's PASS and then PASSAR. So the PASS was likely created. It was created in 1988. So again, as I had mentioned, the Nursing Home Reform Act was created in 1987. This was established the next year, and most likely in response to the Nursing Home Reform Act. And it really was something that really creates this issue where there's, I think, this conflation between PASS and PASSAR. So PASS is for all Medicaid eligible beneficiaries seeking a nursing facility admission to get their needs assessment to determine long-term care needs and the most appropriate setting for those needs to be met. So this is specific to Medicaid eligible beneficiaries, but it does involve a needs assessment for individuals. In terms of New Jersey law, we also include the PASSAR along with this. And I think this is where that confusion comes in, because again, the PASSAR is about an assessment of an individual regardless of their payer source. And they are screened to determine if the appropriateness of a nursing facility placement and to determine if they have that need for specialized services. So these are two issues that when they are combined, this is where I think a lot of this confusion comes in and makes this process that we have in New Jersey just, it doesn't go along with federal law. And I think it just creates a lot of confusion among those that implement it. And so again, PASSAR really should be an essential tool for a state's Olmstead strategy. This isn't something where it's supposed to be, well, this is something that individuals must complete before there must be this evaluation prior to a nursing facility entry. It should really be something where it's supposed to kind of be a bit of a gatekeeper, keeping individuals out of nursing facilities, individuals particularly with intellectual and developmental disabilities is what our report focused on, but really for also individuals with mental health disabilities, it's supposed to be something where it's supposed to serve as this gatekeeper to prevent institutionalization of people with these disabilities. So it really should be an Olmstead tool rather than some kind of rubber stamp to allow people just entry into a nursing facility. So part of what we have found is that there is an over-reliance on these PASSAR exclusions. We found a significant amount of these 30-day hospital exemptions. And again, as I said, one of the big issues there is that a level 2 is supposed to be completed if somebody is staying in that hospital, in that nursing facility past those 30 days. Again, there is supposed to be, there is the possibility for creation of these waiver-like specialized services that could meet the needs of an individual in a nursing facility or in the community as well. And then housing and individualized services certainly serve as a barrier. Housing in New Jersey, I think, is clearly an issue kind of really across so many different areas, but certainly in the world of individuals with intellectual and developmental disabilities, appropriate housing is always a barrier. And again, PASSAR really should incorporate these person-centered practices. It really should be very specific to the individual meeting their specific needs. So for the recommendations that we have in our report, just a quick overview of them. So really the first is that New Jersey should review the state's implementation of the PASSAR process and make revisions to comply with federal law. Again, as I explained, the New Jersey law is very confusing. It's really trying to do a lot of things, too many things at once, and doesn't really get to the purpose of the PASSAR rule. And this should involve key stakeholders, family members, individuals with IDD, they should really partake in this revision process to make sure, again, that it is an Olmsted tool, that it is something that is person-centered. It shouldn't, again, be something that is a rubber stamp. So it's really important for these stakeholders, family members, individuals to be involved in this process to make sure that New Jersey's implementation of the PASSAR law is in alignment with the federal law, but that also, again, that it really meets the needs of these individuals. And again, New Jersey should redesign the PASSAR process with a person-centered framework. That's something that is incredibly important, is really supposed to be something that is part of the PASSAR process, that it really, again, is very person-centered, very focused on somebody's specific needs. Looking into the PASSAR determination requests, again, there are certainly concerns about the use of these categorical determinations, the 30-day hospital exemption. And again, the CMS really asks that states really continue to look at these categorical determinations, that PASSAR process, that it's really something that should be growing and evolving and not remain stagnant, because it then becomes susceptible to overuse and over-reliance. And then New Jersey should amend the definition of specialized services to comply with federal law. Again, New Jersey explicitly states that specialized services cannot be provided in a nursing facility when that is in direct conflict with federal law. And part of that, of course, is that all entities utilizing the PASSAR should receive training on these revisions once they are implemented. And that would mean updating all forms, everything, so that everybody really has this understanding. And again, part of that would be this, making sure that individuals really understand that the PASSAR process is supposed to be person-centered, that it is supposed to be specific to the individual. So I think a lot of these things could be completed and really done together with appropriate revisions to the New Jersey PASSAR law. And so I had also mentioned these waiver-like specialized services. And so there are states that do have waiver-like specialized services that our report focuses on, and says that this could be a model that potentially New Jersey could adopt. And so for example, in Connecticut, there are day services, individualized day services, clinical services related to behavioral support needs. Washington has assistive technology, community access. Nebraska has skill support, employment assistance. Texas has waiver-like specialized services, including behavioral supports, independent living skills. So again, this isn't something where New Jersey would be the first to really do this. There are other states that have adopted these waiver-like specialized services. That could be something when New Jersey makes the appropriate corrections to the PASSAR process, that it potentially includes something similar to this, to again make sure that these are really specific to the individual and meeting their individual needs. So that is the conclusion of, just kind of my brief overview of this section. Again, it's the PASSAR process is fairly complicated, very confusing, and so it's something that I think is very understandable for people to kind of be confused by the first, second, third time that you really kind of go through this. And I'm happy to answer some questions, but I did just want to note that our final webinar, so it's the fourth webinar in our series related to Key Finding 3, is going to take place next Tuesday, October 31st at 10 a.m. And that's going to be with my colleagues, Adrienne Langlois and Craig Ismaili. And you can also link up to that on our website. And then we do also have the QR code that you can scan, or you can visit our website to sign up for that. So I see there is activity in the chat, but I haven't been able to take a look at it.
So Bren, I'll step in there because I've been kind of paying attention to the chat, and I don't know if maybe we want to take the slide presentation down and just be able to see people. So I'm going to read some of the questions. And I'm going to say two things first. One is I'm having a really bad asthma day. So if I start coughing uncontrollably, I'm going to turn it over to my colleagues. And second is there's just been a tremendous, so thank you, Bren. It was an excellent presentation. And there's just been such a lot of activity going on in the chat with some amazingly great questions and conversation back and forth. At one point, Adrian and I were trying to answer some of the questions, and I wrote to Adrian privately and said maybe we should stop doing that because we want to make sure we say the questions out loud and everybody can hear the answers to them. And the other thing I'm just going to say real quick is that the order of them has jumped around in my chat box. I can tell that. I don't know why that happens, but I am going to go into the order that they are now, which is not necessarily the order they were asked in because they've moved around. So the first one, Bren, is a question about some data that this person has. We have similar data. It doesn't really matter what the numbers are, but between January and April of 2023, there were 245 people who received a level 2 PASSAR. I think our data is from January through June, so it's a little bit different. It doesn't really matter. Our number, I think, is 335. And the question is, what other residential options were given to these folks besides nursing homes, which is a great question. I remind everybody we are not DDD, but I can tell you what we think was offered. Bren?
Yeah, so if somebody does receive that full level 2 evaluation, they are supposed to receive options counseling. So our analysis and data doesn't really get into what does that specifically look like, but that is supposed to be part of that full level 2 evaluation process. That is options counseling, and that would, to that question, speak about other residential, that should speak to other residential options that are available to folks that, that might be other than a nursing facility.
So if I could just add quickly to that, because we did look at the level 2 forms and they evolved over time, by the way. So every single one isn't exactly the same depending on what year the level 2 form was from. But one of the things we did notice is for people who have a categorical determination, after the categorical determination, the form tells the evaluator stop, like literally has a little stop sign on it. And so it doesn't get to the piece that Bren was just talking about, which includes some options counseling and limited, very limited HCBS options. So we think for all the people who, we don't know this for certain, we're speculating based upon what we reviewed, for the people who had categorical determinations, there was just a hard stop at that point. And so they didn't go further, even though we interpret the federal law to say for advanced categorical determinations, they're still required to do an individualized determination about specialized services, which is also below that line.
Yes, so. Yeah. Thank you, Gwen. Yeah, that was, when I was speaking to a full level 2 evaluation is what's supposed to happen. But yes, the part of the issue for sure is with the forms right now that they have that stop sign that prevents that, most likely prevents that from happening.
And I want to say also categorical determinations, you've said this, but I really want to emphasize that they are optional under federal law. And one of our recommendations is that the state revisit that, because it does seem that that is prematurely ending sort of the evaluation and the inquiry with that person instead of moving forward. There's no reason they can't do the full level 2. The federal law does not prohibit that, even where categorical determinations come into play. So, and
I do think too, Gwen, that, it's also so important. I know that I mentioned it, but I do think it's worth mentioning again that they are, that there are supposed to be time limited. And our report lays out that in terms of the terminal illness, that categorical determination, again, that's supposed to be that somebody has a prognosis of 6 months or less, that we saw individuals that it had been years since that categorical determination had been determined. And so, that does also clearly create this issue that if there isn't some kind of accountability that triggers okay, this time limited exception, you know, really is kind of up, and something needs to happen. There needs to be a full level 2 evaluation that's completed. That obviously also leads to the possibility that these categorical determinations are being overused.
The next question is, how is severe physical illness defined? And that both Adrian and I did drop a lot into the chat, so hopefully that answers the question. The next one is DRNJ planning to sue New Jersey for their failure to meet federal obligations to prevent placement in nursing homes. I am going to take this one, Bren, because the buck stops with me. And the answer is, as a P&A, we have a variety of tools in our toolbox, a variety of strategies to make systemic change. In this situation, we decided to do a public report. I think the public report speaks for itself. I think that throughout the public report, you can see that we think there are significant violations of federal law, and at this point in time, we're giving the state an opportunity to engage in discussion around making these changes, but they are significant changes and they need to be actually made. Like, I really want to affirm that sentiment that runs through this. This is not something that can have one conversation, that's nice, thank you very much, and we don't talk about it again. That can't be. So, all right, I'm trying to get my cursor back to scroll down more about, okay, so there's a comment about the definitions of severe physical illness that says being ventilator dependent can be handled appropriately in a community setting. That's more of a comment, Bren. I don't know if you want to respond at all to that. I think we agree.
Yeah, absolutely. Certainly it's, you know, again, this is something where the waiver like specialized services, when I was speaking about how specialized services cannot only happen in a nursing facility, that it is possible that they can be provided to people in a community setting as well. That this does certainly, you know, include high care needs. Like if somebody is potentially on a ventilator, it can certainly be provided for somebody in the community.
The next question is, can you address the flip side of Olmstead? What services are available in the community to support those with severe autism and severe challenging behaviors? Group homes do not take these individuals. Interested to know what DRNJ would suggest. Olmstead is not a mandate, as you state in, I think IMO means, in my opinion, the less restrictive environments for these individuals does not exist in New Jersey. And we did put some answers to that in the chat, but I think it is important, Bren, for you to address that one.
Yeah, I'm just trying to look at some of the responses, so I'm not being too duplicative. But you know, again, so the Olmstead was decided, again, as I had mentioned, in 1999, and it is something where it does very explicitly state that individuals with disabilities are entitled to receive services in the least restrictive setting possible. And obviously, nursing facilities, institutional settings like nursing facilities, even like developmental centers, are settings that are very restrictive to people. And if there is a possibility that they are able to have those, some of those care needs met in the community, they are entitled to receive those services in the least restrictive environment possible. So I realize that this is not, you know, you can say that putting that into practice is obviously difficult, that there are, you know, it does require that the state develop a robust set of needs in the community, that it's not, well, you know, somebody maybe has some high care needs, perhaps like a ventilator, perhaps it's behavioral health needs, something like that. So therefore they must go to an institutional setting. This is really a situation in which the onus is then on the state to develop these types of services in the community, so that the default for individuals, particularly individuals with disabilities, intellectual and developmental disabilities, are not, the default isn't to place them into an institutional setting like a nursing facility. So if it's a situation in which there might be some group homes that that aren't willing to accept somebody that has some of these higher care needs. That isn't it, the way that we view it at DRNJ doesn't mean that therefore now that person must be institutionalized. The problem really is that those kinds of services need to be developed and maintained and appropriate in the community to allow for these individuals to receive those services in that least restrictive setting possible, like potentially a group home, any other kind of community setting. I don't know if any.
Yeah, no, I just want to add to it that this paper really is looking as nursing homes, right? And what we found definitively, without doubt, is that nursing homes are not meeting the needs of people with IDD, and that people aren't having a meaningful opportunity to discuss home and community-based. To the extent it doesn't exist, appropriate services, settings, and supports, it needs to be developed. And for those who need the services of a nursing home and choose it, and there are situations that people might choose it. For example, maybe they need short-term rehab, and that makes the most sense. They should still be being able to access specialized services during that time. The next comment is really a comment. It's not a question. It says off topic, but I want to address it because it's something I'm really excited about. But would be interested in hearing if families can was being off topic, but would be interested in hearing if families can self-direct who are ventilator dependent. This is sort of a sneak preview. Hopefully by the end of this week, our goals and objectives for 2024 will be up, because our year started on October 1st. And one of the things that we are looking at is we're focusing really on private duty nursing, but looking at having adequate services in the supports in the community for people who are on the DDD waivers. And one of the activities we're talking about doing is having some listening sessions with families. So once we're ready to start doing that, I can see that our communications director, Dana, is on. Dana will be putting something out in an e-blast or letting people know how they can sign up for those listening sessions. And I think this is the kind of thing that would be a great discussion in those listening sessions to make sure that we're really fully informed as we're thinking about our strategic strategy going forward on this issue about the DD waivers and making sure that people really can use their whole budget. So next question is, what is the difference between specialized services and active treatment, for example, in a DC? And again, we put in a little bit of an answer to that, Bren. I don't know if you want to add to it.
I don't think I have too much to add. I know Adrienne spoke about this as well. It looks like she was able to provide a great response. I don't know, Adrienne, if you have anything else you want to add about this. No, it looks like no. It looks like maybe getting off mute might be a problem. But yeah, she provided a very thorough answer to this. I know we talked about this at the last webinar as well, but yeah, certainly. And then it looks like, and I think I'm following the chat now correctly. It says who wins due to this confusion. I'm assuming that the confusion is the reference confusion is about with PASSAR. I'm assuming just kind of the specialized services. I'm not sure if there's kind of a more specific what you're referring to in terms of the confusion. But it says, are they at fault here and can they be sued again? So like Gwen had mentioned before, so this isn't, this is not, our organization isn't one that takes really kind of personal liability cases, anything like that, and sues on those behalf. In terms of the winners here, I'm not sure that I can really speak to that either. I don't really think that this is a situation in which there are nursing home lobbyists winning, there's no nursing home owners winning. I think really the focus of this report is about the people that are losing, and the people that are there. This is supposed to be focused on, which is people with intellectual and developmental disabilities. That when the PASSAR process that is supposed to be person-centered and is supposed to be a tool of Olmstead, and that is not being properly implemented in New Jersey, then the people that lose are the people that is supposed to protect. So I think that, it's something, again, that's really just the whole focus of what we're looking at is how these laws are supposed to be protections for people with intellectual and developmental disabilities, and that's just not happening.
And I just would add, so clearly New Jersey has to change the definition of specialized services in order for this to work in nursing homes, and they have to do a lot of other things. But in the meantime, and I think it goes to this point, the federal law was amended in 2016 to say that if an individual needs what's called specialized rehabilitative services, which are services that are IDD specific, but don't rise to the level of specialized services, that is already embedded in the nursing home rate, and that should be outlined in the person's care plan. And I'll be honest, we didn't look at that. Like, we didn't do a data analysis of how many people have care plans with specialized rehabilitative services, but that would be sort of an I'm sure the state knows from like claims data or things like that. So it would be interesting to know that. And certainly we want to get the word out to people living in nursing homes and their families that if this is something you think you need, like, that's available now. We don't have to wait for the change in the law for that. That should be in people's care plans in nursing homes now. And I am going to continue on in the questions. And who does the options counseling? That's a great question. What are those HCBS options? So I think you touched on this a little bit, Bren, but did you want to touch on a little bit more?
Yeah, so the again, I mean, in terms of the we had spoken about how part of the problem with the options counseling is that the way that the level 2 evaluation is set up right now really seems to limit the fact that people actually get to options counseling. And in terms of these HCBS settings, there's really, a variety of settings that are possible in the community that might be an option. Again, it's really about this least restrictive environment, and that is going to change depending on the person. Again, this is really about the person and their needs. And that is similar to what Gwen was saying before about how, really it comes down to choice, that if somebody does need a nursing facility level of care, does want to receive those services, that is possible, but that there should be these robust home and community-based options available as well as an alternative and as a least restrictive option for these individuals.
And then I'm sort of consolidating a theme through a couple of the last questions, which is whether or not DC admissions is part of what is offered to people when they're looking to go into a nursing home. And I think the short answer to that is no, it is not. There aren't, that is not part of the PASSAR process to offer people a DC admissions. It's really about, truthfully, at this point in time, it's a rubber stamp for nursing home admissions, in our opinion. So I also saw a note here to talk to Denise about last summer when Denise did significant outreach about with the medical special needs listening session and focus group with her. Denise and I have talked about that in the past. We'll talk about that again. But again, I just wanted to preview that we're going to be doing some more listening sessions in the coming year, probably after the holidays. So to just keep an eye out for those. And then this, I think, is a rhetorical question, but what do families do in the interim if services for those with severe autism and severe challenging behaviors are not available in the community? This is a serious issue, safety of the individual and caregiver. I would have to say duly noted to that. We hear that. We're not, we're paying attention to that. We've heard that loud and clear. And frankly, I've been in a nursing home where there was an individual who had challenging behaviors and observed, it was when I first started here, and observed firsthand the inability of the nursing home to really provide the services that person needed in the nursing home. It was very concerning and troubling to me at the time. Bren, did you have anything else that you wanted to say on that?
No, I think you are right on point with that. I was just jumping ahead a little bit.
Yeah, I'm
to
looking,
some of
there's
the
the
other
comment about
questions.
the North Princeton study, and I have to say thank you for that, Linda. We did not go back that far in terms of sort of the historical look, but after you sent me the email, we did get that study circulated to everybody. And we are, it's definitely something that we're going to go look at with the study that relates to the closure of North Princeton. Will I be amending the report based on that? It's a great question. Not going to amend the report. However, like we might say something else publicly about that when we take a look. I don't ever want to have to amend the report. The report was a labor of love, but that doesn't mean we won't say something else about that. And I think this is a little sneak peek too. I think we're also looking about doing some sort of outwardly facing issue brief, not as long as this report on people with mental health disabilities and the PASSAR problems, because again, it's not just people with IDD who are feeling the ill effects of New Jersey's mistaken interpretation of federal law on this. Bren, we're down to 3 minutes, so I'm going to give you the last say.
Yeah, thank you, Gwen. I was just going to mention that, yeah, certainly, I think we all know at DRNJ that this report really is just the beginning. We didn't focus on developmental centers, and we did all take a look at that study that you had sent, Linda. But it is something that clearly we've not only been able to find some of these issues, some of these findings specific to the report and individuals with IDD in nursing facilities, but it's really been something where, the more you dig, kind of the more issues that come up and the more that you want to do. And we're, certainly going to do our best to go at, really a lot of these issues. Because again, just a big focus is about the rights of these individuals, their rights that we really can't argue with, that they are entitled to live in the least restrictive setting possible. So I am just trying to make sure. I think there's just one other comment about the significant death rate of nursing homes. So I wasn't sure if that was speaking to the some of the concerns that we had about the drops in numbers with the MDS data about individuals from the first quarter of 2020 to the second quarter. But we do have a recommendation in there that the state do some kind of analysis to find out what happened to those individuals. But I just want to say thank you very much to everybody for participating, again, for having so many great questions in the chat. Like I had mentioned before, our final webinar series on Key Finding 3 is going to be next Tuesday, Halloween, October 31st at 10 a.m., where we're going to discuss that final finding, talk about the recommendations related to it, and certainly please, we encourage you to check out our website. It has, it has the report, it has different interviews, but then it also has lots of additional information about everything that we found in this research. So thank you very much to anybody. Gwen, do you have anything else?
I don't believe that I have anything else other than please come again next week. And I'll also share that we're presenting nationally on this on November 1st at the Consumer Voice Conference, which is primarily long-term care ombudsmen from across the country. And we also expect some of our federal partners there. So we're very excited about that. And, I just want to give a shout out again to the New Jersey Council on Developmental Disabilities for supporting this work. It couldn't have been done without them. And, doing this webinar series and then having an opportunity to present nationally. And what we're finding is, some of the ways that that we're just are really excited about this advocacy. So thank you, everybody, and keep the good questions coming. You're an excellent audience.
Thank you.